For over 50 years, BoulderCentre for Orthopedics and Spine has been serving patients in Boulder, Broomfield, and the entire Front Range. As the region's most preferred orthopedic practice, they offer the latest in joint replacement and revision techniques in their state-of-the-art facilities. Their doctors are highly trained specialists focusing on and dedicated to delivering orthopedic excellence. And we recently took a trip to their Boulder location. Take a look. So, Dr. Mayo, you have a really impressive background being a Division I soccer player and a fellowship-trained surgeon. What inspired you to pursue orthopedic surgery?
I would say two things. I definitely played soccer my whole life, starting at about age 4, and unfortunately saw some teammates sustain some really dramatic injuries, mostly orthopedic, that did require surgical intervention. So it was really interesting to see how quickly they were able to get back to life after orthopedic surgery, including returning to sport. I would say that was probably the predominant motivator, to see that you could make such an impact in someone's life when they've had such a terrible potentially life-changing injury. Secondly, I would say my father was an architect, and so orthopedics is a lot about planning and a little bit like carpentry. And so that really factored into my interest, I think, in the planning side of surgery and things like that.
That's an interesting take. I've never heard anyone say that before. Now, you have studied at Stanford. You've worked with the 49ers. I mean, these are some elite experiences. Mm-hmm. How does that translate to the patient care here for Coloradans in Boulder and Broomfield?
Sure. So by having, experience with both collegiate and professional athletes, the real overarching theme is getting them back to their goal. And that is to play professionally or to finish a certain season, depending on what age they are or grade in college. And I think that translates to a lot of people here in the area. We do have some very competitive and even professional athletes in our community, but we also have people who are pursuing really, really impressive athletic goals. And so just trying to help them reach their athletic goal translates across all levels of athletic activity.
Okay. What types of either injuries or different patient conditions do you typically treat here at BoulderCentre?
Sure. So our practice is very lucky in that we have a lot of subspecialists. So we're pretty focused in terms of how patients get the most streamlined care in terms of which physician they're seeing. My training is in sports medicine and shoulder in particular. So I see a lot of shoulder-related injuries, also knee and other upper extremity injuries.
You just mentioned some complex, I'm sure, shoulder procedures is what you specialize in, as well as minimally invasive procedures. So if someone is experiencing any type of shoulder pain, what are some signs that they should come and see you?
So I always tell people, if you've had a significant shoulder trauma or traumatic injury that's resulted in a decline either in range of motion or strength, I always recommend getting assessed. Other signs would be if you've had a more minor injury or perhaps overuse-related pain, and it's been about a week, it's probably reasonable to come in and get checked.
So, doctor, there's been a lot of buzz around biologics. So what type of innovations are you really excited for when it comes to orthopedic care?
So I think there are two categories that I've seen the most progress in the past few years, and I think there's a lot of potential for further improvement. One would be in the realm of biologics, particularly surrounding knee-related injuries, the research and data supporting the use of biologics, and something in particular called platelet-rich plasma, which is an injectable biologic, is really exciting. And we're seeing more and more data that can actually treat things that are really common, like arthritis, as well as also address more soft tissue or tendon-related injuries. The other section of development that I'm always interested in and is ongoing is the industry-related research and development surrounding implants that we use during surgery. Things just seem to be getting lower profile, easier to use, stronger, and so it makes our surgeries more efficient, which I have seen in my patients directly result in a quicker and more comfortable recovery.
That's wonderful. And I understand that here at BoulderCentre, a patient-centered approach, tailoring things to the patient is really important. So when someone comes here, what's the experience like? What should they expect?
Sure. So we have patients who come in and have had no treatments and no imaging, meaning x-rays or MRI. And so sometimes we're just getting started from scratch, and we're fortunate here we have the ability and have a very well-rounded entity here where we can provide x-ray, physical therapy, MRI, even assistive devices like if you need a brace or something like that for your injury. So we're kind of a one-stop shop. So I think being respectful and efficient with people's time is really helpful. That being said, at the other end of the spectrum, there are people who've come in who've already done all these non-surgical treatments, have all the imaging, and then we have the ability to help them plan the more advanced steps of treatment.
And I know that you have lived and trained all over the country, but you landed back here in Colorado. So what was it that brought you back?
I think honestly, it's the community, especially in Boulder, you know, a very active, very health-oriented community, and that's so motivating on a daily basis. I also think it's a great example for kids and families. So that was the main reason.
Well, and speaking of being active, you're very active yourself when you're outside of the OR, you know, if it's the typical Colorado hiking or biking or skiing. So how does being active yourself help to translate when it comes to the care that you provide to your patients?
I think one, you need to practice what you preach to a certain degree. So you're telling people that you need them to maintain commitment to, say, physical therapy or healthy behaviors to recover well from surgery. So that being an example for your patients is important. I also think I've sustained injuries myself and can have relatable stories to share with patients about how I recovered and how long it takes, and that you do have to be patient.
Wonderful. Thank you, doctor. And to learn more about Dr. Mayo and her specialties, visit BoulderCentre.com. That's also where you can find details about the orthopedic care services provided, like Mako Smart Robotics Technology, MRI scans, orthobiologic injections, physical therapy practices, and more. Visit one of their Front Range locations in either Broomfield or Boulder. And to schedule an appointment, call 303-449-2730. BoulderCentre paid for this segment. Stay with us.